A Chinese New Year gathering has been established as a possible link between two COVID-19 clusters involving churches. One of them is the Grace Assembly of God cluster, Singapore's largest. Health authorities say establishing a chain of events is an assurance that the two clusters are now under control and were not a result of widespread community transmission. So here's how the infections took place. Cases 8 and 9, a married couple from Wuhan, arrived in Singapore on the 19th of January. They attended a church service at Life Church and Missions on the same day and infected 6 people, including today's newly announced case 91. And she is married to a previously confirmed patient, that's case 83. The pair had attended a Chinese New Year family gathering at Mei Hwan Drive on the 25th of January. Another 9 people were infected in that gathering, and one of them was case 66, a 28-year-old man who works at Grace Assembly of God. He triggered a slew of infections at that church, which at last count numbered at 23, and they include its senior pastor, who has since recovered. Our reporter, Lily Ying, has more.
Now, case 91 is the first person confirmed to have been infected after she recovered by mid-February. Now, this was made possible by a test developed by Duke NUS Medical School that detects virus-specific antibodies after a person has recovered from the infection. Now, authorities found case 91 by first tracing case 66, the primary source of infections at the Grace Assembly of God cluster. Now, investigations revealed that he was at a Chinese New Year gathering also attended by case 91 and her husband. Now, days before, the couple had visited Life Church and Missions, where an infected couple from Wuhan was also visiting.
Now that we are able to determine that the source came from primarily from the Life Church, and therefore the Life Church cluster is already defined and contained, and they are under quarantine and under treatment and so on. So I think there is a greater assurance that these two clusters are now within the control.
Ultimately, the chain of events that we could establish allowed us to establish a link to travelers that originally had come from Wuhan, China, where we already had known had a very high incidence of COVID-19 infection. This gave us confidence that in fact these cases were not as a result of widespread community transmission from other sources, but in fact it was as a result of a sequential series of events that ultimately led to infections occurring in one setting and in a different setting as well.
Now, from 11:59 p.m. tomorrow, new visitors who have been to the Korean cities of Daegu and Cheongdo in the last 14 days will not be allowed to enter or transit through Singapore. Singapore residents with travel history to these cities in the last 14 days will be issued a stay-home notice and have to remain at home at all times for 2 weeks after returning to Singapore. Now, the same applies for long-term pass holders, including those who are working or studying. But the government cautioned that it's not possible for Singapore to shut itself out of the world if the virus becomes widespread and endemic in the human population.
How many more cities can we sustain travel restrictions on? Again, it's very hard to say with certainty how this will go. In such a scenario where it is widespread, it's everywhere in the world, we will have to reassess our approach, and we will have to reconsider what is the best and appropriate measures that we will have to take.
Now, responding to questions on whether the government will lower the DORSCON levels to yellow, the minister said it is a judgment call.
It's not possible for us to isolate Singapore from the rest of the world. It's not just economics, but the human-to-human interaction, country-to-country interaction, it is not possible. So we may have to then readjust our posture and decide what we want to do. And if that situation occurs, we may have to adjust our DORSCON level downwards as well.
Now, the panelists also shared what Singapore has learned about COVID-19. Now, they said that the lung injuries found in patients may not be a result of the virus, but rather the response of the body's immune system to the virus. While there are some treatments in other countries that are found to be beneficial, it's still early days yet. Now, 80% of the cases in Singapore had mild symptoms and do not require further treatment. And those with mild symptoms are currently hospitalized to prevent spread of the infection as authorities try to understand the new disease. But there is a possibility that in the future, only serious cases will be admitted to the hospital.